This is Dr. Robert Watkins, orthopedic spine surgeon to professional athletes and creator of the Back Doctor app.
Hi, welcome back. So I want to start a segment today on back pain. And I'm going to talk about what are the sources of back pain, what's the history, what's the exam, what are the tests we get, what are the treatments we have, how to avoid surgery, when does surgery work, what's the rehab look like for the rest of your life. I'm going to try and do about 5 minutes each day where we take this huge topic of back pain and break it down into different segments, and then hopefully you can pick out the parts that are relevant to you, and maybe the whole thing as a package would be helpful. So today's topic is the sources of back pain. Everybody gets back pain at some point in their life. About 50% of Americans will lose time from work due to back pain at some point. So it's a fundamental problem that affects everybody all over the world. And as we get older, it affects us more and more, speaking from personal experience. So first of all, what causes the back pain? When your back hurts so bad, what is it that's hurting you so bad? And part of the problem with back pain is there's so many potential sources. We don't always know what's causing the pain. You know, one of the crazy parts about my job is we operate on pain, but we can't measure pain. So we never know exactly what's causing somebody's pain because there's no test to say, oh yeah, here's the measurement for pain. There is no test. We rely on talking to people, examining them, the test, all these things. The more these things overlap to point to the source of the pain, the more likely surgery may actually help. But it fundamentally comes down to what's causing the pain. So some of the reasons for pain, here's a spine. This is like this on me. These are the vertebra. These are the discs in the middle. These are the nerves coming out. So first of all, for every disc in the front, the disc is the main mover and shaker and biomechanical stabilizer of the spine. So 80% of the weight and the stress of your body goes through your discs. So when somebody has back pain, we think it's an injury to the disc. And that's what we tell everybody. Let's assume you have a tear in the disc. That's what's causing the back pain because that's where all the biomechanical activity is occurring. So the odds are about probably 80% it's coming from a disc. So that's number one is the disc. The disc is in the front. And then in the back, you have two facet joints in the back. See, that's where the motion occurs in the back. For every disc in the front, two joints in the back. So look how many joints you have between here and here. You got 10 facet joints and 5 discs. Now the facet joints can hurt as well, but the facet joints, look how small they are compared to the disc. They only pick up about 20% of the stress, 10% in each one. Therefore, the chance of them being a source of really debilitating pain is a lot less than the disc because they're a lot smaller and they don't see as much stress. Now, they can be a source of the pain. Sometimes we really identify a facet joint as a source of pain, but usually it's the disc. Then it'd be the facet joints, and then the nerves come out. If you get a pinched nerve, the pain can start in your back, then it may go into the butt or down the leg, but it can start in the back, and sometimes it doesn't go down the leg. Sometimes it stays in the back, and it's nerve pain. So those are the three main ones we look at your spine. The disc, number one, facet joints, and then the nerves coming out. Those are the anatomic ones. But then you also have muscles. You have muscles that attach in your back, and if you get chronic contraction of the muscles where the muscles are in the spasm and they're firing all the time, then they don't get enough oxygen and so you get anaerobic metabolism, a lack of oxygenation. Well, a byproduct of the Krebs cycle and anaerobic metabolism is lactic acid. Lactic acid can build up in the muscles because of this lack of oxygenation and chronic firing. Well, lactic acid is a pain mediator. So you can have pain from this buildup of this toxic byproduct that builds up, and that causes pain in and of itself. So some people have emotional and mental stress they hold in their muscles, which can cause back pain. Yes, the mental and emotional stress can cause back pain from a physical reason. It's because of the chronic muscle firing and the lactic acid that builds up. And we can't measure for that. There's no test to know that, but that can be a part of the pain. Now, it's like a chicken or the egg phenomenon where sometimes you have pain from the disc that causes the muscle tightness, which causes pain, which causes stress, which causes more muscle tightness, which causes more pain, and they compound upon themselves. One of the important things about my job is sorting out how much of this is anatomic physical that we may be able to treat for physical things like injections and surgery. How much of it is mental and emotional stress being held in the body, which is manifesting as pain. And it's hard because there's no distinct formula for working that out, but that's part of my job. That's what I've been doing for 20 years, is working this out as to when do I think it's physical, when do I think it's mental, when do I think it's a bit of both. And I really rely on patients. Part of the reason why I make these podcasts and Facebook Lives is to educate people, because I'm dependent on them to help tell me how much is it physical, mental, emotional, disc, facet. We got to work together to sort this out. So those are the big ones in your body. Physically is the disc, the facet joints, the nerves, the muscles. But then you also have other organs. You've got your kidneys, your ovaries, your GI tract. You can have strange tumors. This is not a comprehensive list, so don't hold me responsible from a medical perspective. But I'm telling you all the big hitters as to what we see. And then also your SI joints. Down at your sacrum, this is your lumbar spine into your sacrum, and then your pelvis, your iliac wing sits here. There's a joint right there. That can hurt too and can cause pain. So we've got a lot of the ways we determine what is it. We go by the history. How do you describe your pain? Is that typical for how other people describe pain who have this condition? When I do an exam, that tells me an idea as to, is it a disc, or is it a facet joint, or is it a nerve, or is it muscle tightness? We get diagnostic studies, MRIs, bone scan, nerve test, and then we try the treatment. We may inject certain things and see what that shows, and that's how we work it out. So the start today is what's causing the back pain. Disc number 1, 80% of the stress through the disc. Number 2, facet joints. For every disc, you got 2 joints in the back. They can hurt too. Number 3, the nerves. They can start there. Number 4, the muscles get tight. Number 5, your SI joints. Number 6, organs in your body can refer pain back there too. Hi, I'm Dr. Robert Watkins, Jr., joining you again on our segment on back pain. And what are the causes, what are the treatments, etc. Our first segment was on what are the different sources of back pain, the disc and the nerve and the muscles. Today I want to talk about what are some of the causes as far as what brings it on, what are the injuries that happen that result in the back pain. Some of the misconceptions and some of the things we sometimes take for granted. So first of all, I also want to mention, when to worry about your back pain, when it may be more significant. Last time I mentioned that sometimes tumors and cancers, different things that, rarely but can cause back pain. When do you need to worry about something really serious? There's a couple red flags that we look for as healthcare providers. One of them is fever, chills, systematic symptoms where your whole body just doesn't feel right, unexplained weight loss. If something's going on in your whole body and you're having back pain, that makes us more worried that you may have some type of disease, cancer, tumor, something like that we need to look at. Also, from a back perspective, is how are the nerves working below your lower back? Your bowel and bladder function, if you are losing bowel and bladder control, or pain and burning sensation, weakness into your legs, those are other things that really set off a red flag to concern us, that are going to make us say, hey, don't try and just do our app and do physical therapy for 3 months. Come see us first and let's get a workup and see what's going on. Or your local doctor, go immediately and check them out. So those are things that we always look at, set off red flags as to, this really needs to be addressed and looked at urgently. But as far as what are the activities that cause the injuries to the back, number 1 is aging, which, aging sucks, but it's better than the alternative. And as I've mentioned before, aging starts at age 28 on average in people. That's why athletes peak at around age 28, and it's all downhill from there. And that's true for all of us, is that we're just hanging on by dear life for the rest of the 50, 60, 80 years we have to go. And so aging, the degeneration of the disc and the joints, they're slowly deteriorating at age 28. And anybody who's past 40 can attest to that. Yeah, we're on the downhill slope. We can tell. But fortunately, we know a lot of things that can help, and that's what, I'll put our link below that talks about our app and talks about our podcast and what you can do to help yourself and avoid surgery. I'll put that on there. But basically, aging is the number 1 cause of back pain. It happens to all humans. It's just part of life. Deal with it, and we'll figure out how to move on and address it and make it as good as possible. What about specific activities? Lifting, rotating, and bending forward. I got my network connection. Bad connection. We're back on. So what stresses the disc the most is forward flexion, rotation, and picking something heavy up off the floor. Like a 2-year-old trying to run past you, running out into the street, having to bend over and rip them up off the ground. Yeah, that'll stress the disc the most significantly, and that's when people can injure their disc. That being said, most people come to me, at least half people who come to me develop pain and have no idea why. They might have coughed, sneezed, brushed their teeth. something totally woke up with it. And it's such a mystery to them as to why did this pain start. Sometimes it's a car accident or a fall or some traumatic event, but usually it just starts. And then sometimes it never goes away. And that really is such a mystery to people. We're used to breaking our arm or doing things significantly. Sometimes these discs get injured, and it's the most benign activity of daily life. It's a little bit scary. It can happen at any time, but that's how it goes. That's what it is. Usually they'll heal on their own. But they can happen from the most benign things. But like I said, that forward flexion, rotation, picking something heavy up off the floor, that usually stresses the disc the most, is most likely to injure the disc. And with that goes basically any loading of your spine if your spine is not in a perfectly neutral position. Of all the athletes we see athletes in every sport, and like I said, of every level, recreational all the way up to pro, women, men, everybody, old, young, everybody. 50% of the athletes we see hurt themselves in the weight room these days because every sport lifts weights. How are you going to get your butt and your leg strength sufficient to generate the power that you need to throw, run, kick, shoot, skate, crew, rowing? It all comes from your core and your butt and your legs. So squatting and deadlifting is how you generate a lot of that power and strength. And so that's integrated into just about every sport in America. And 50% of the athletes hurt themselves in the weight room. It's not that it's bad to lift weights. Lifting weights is essential to a lot of sports to be really competitive. But the key is you need somebody to watch you and make sure you have proper technique and form when you do it. John Meyer's a great resource, works at USC, been in Los Angeles for a long time. We have a lot of great, Brandon McCarthy, who works for the Dodgers as well. We got a lot of people we know that are experts. Every football team in America has multiple experts that know how to watch somebody in the weight room and make sure their hips and their knees and their quads and their balance and their upper torso is all aligned properly so that it's loading the discs and the facet joints properly to absorb the stress so it's not going abnormal. The biggest thing we see is tight hips. Kids start lifting weights so early, they're all big and strong, they got tight hips. So when they squat, they tilt forward, it loads the disc abnormally, or they hyperextend, which loads their pars and they get a stress fracture. So proper mechanics are really important to lifting weights, and having a professional help you learn how to do that is essential if you're going to really take it to the next level and try and be a professional or play in college for it. So then the other part is, and so lifting weights is good, but you got to have a good core strength too. Our Back Doctor app, the 5 levels of back strengthening, we want people at a level 3. 5 is the hardest. We want you to average a level 3 before you start lifting weights. And before you really start squatting and deadlifting, especially after a back injury or after back surgery, you got to be a level 4. We got to know your core is strong enough to help absorb some of that shock and stress so it doesn't just go straight on your spine and helps protect you. And then the other part that people always ask about is, well, who gets back pain? And people just assume that obesity correlates with back pain. And so they always say, I know I got to lose 50 pounds, but God, my back hurts so bad I can't exercise, so I can't lose the weight, so my back hurts more. And it's interesting because obesity has never really been correlated with back pain, even though we all just assume that it is. I see a lot of skinny people with a lot of back pain. The only thing that we've really seen is cardiovascular exercise helps decrease back pain. It's not losing weight. It's not even doing core exercises necessarily. Cardiovascular exercise circulates your blood, washes out lactic acid, and releases endorphins so you feel better, so you tend to have less back pain. And that's the only thing we've really seen. There hasn't been a direct correlation with obesity, even though everybody assumes it. Now, being obese is bad for your heart and all your joints and all sorts of issues. But at the same time, sometimes it's overvalued. And people, like I said, they get stuck in this conundrum. Well, my back hurts. I want to exercise. I'm getting fat. But if I exercise, it hurts my back. And so they don't do anything. And for your weight, you got to control with your diet. Your purpose of your exercise is to be healthy, get your heart rate up, break a sweat, feel better, and do core exercises to take the stress off your spine. As far as genetics go, we've certainly seen some familial disposition. Certain families tend to have more back pain and scoliosis, but there is no direct genetic gene that says you're going to have back pain or not, at least not at this point. Most things in science and medicine have turned out to be about 50-50. Yes, genetics plays a role. About 50% is the biology you've been born with, and about 50% is the environment and what you do with yourself and what kind of life you live. And so at least 50% is controllable and manageable, so we got that going for us. And the other part I want to mention is activity. A lot of people assume that athletes, especially like football players, after they finish football, that they're all in back pain because of the beating their body takes. But what we've seen in all sports is a lot of athletes continue to be athletes once they've retired. They stay in shape. They're good physical specimens to start with. And they don't necessarily have more back pain because they're good athletes and they stay in shape. And so the incidence is not necessarily increased in ex-athletes after participating in sports. So I hope that's been helpful. Some of the causes of developing back pain, the mechanical activity, bending forward, picking something up off the ground can stress the disc the most. At the same time, like I said, the mystery for a lot of people is they get back pain, they don't know why. And we always want to know why. What did I do? Can I blame myself? Can I blame somebody else? The reality is, if you live past the age of 28, it's probably going to happen. But fortunately, there's things we can do. Stay healthy, eat a healthy diet, get your exercise in, do your core exercises. I'll put the link below with our app and all the information on there of how we can help. Hi, everybody. So this is part 3 of our segment on back pain. And now we're going to talk about the history. When patients come into me and I see them in the office, we always start with the history. And so these are some of the questions I ask and why I ask them, what we want to discern out of the history, and what it means as to what's the possible source of the pain and what we can do about it. So first we covered the potential causes of the pain and the sources. Now we'll do the history. So one of them is the mechanism of injury, which we talked a little bit about before. If somebody forward flexes and picks something heavy up off the floor, it's more likely a disc injury because that stresses the disc, as compared to if they're leaning back and extending back, it may be an injury to the pars, they get a stress fracture, or an injury to their facet joint. And especially if I see a young athlete, 15, 16 years old, a gymnast or a weightlifter, football player, baseball player, any repetitive activity that loads the posterior part of your spine, it's likely to be a stress fracture, which we see a lot in kids. So the history tells us a little about what was the mechanisms of injury, and was there a specific biomechanical load that may have injured a certain part. First we look for that. Then the other part is what provokes the pain. Is it sitting or standing? Or those are the two big ones, sitting or standing. If it's sitting, when you sit, you load the discs, you increase pressure in the disc, and it can increase pain from the disc. So if you can only sit for 5 or 10 minutes and you get a lot of back pain, well, it may be the disc causing the pain. But here's the difference. When you sit, you load the disc. If it causes back pain, then it may be the disc itself causing the pain. If it causes leg pain, sciatic pain going into your butt or going down the leg, well, then it's more likely nerve pain, because the disc can bulge a little bit when you're sitting, and so if a nerve is going and the disc is bulging back, it can put more pressure on the nerve. And when you sit, your nerve is stretched because your hip is flexed. So as your hip is flexed, the nerve is stretched, and so people with sciatica and nerve pain are more likely to get leg pain when they're sitting. So if you sit, it can either be the disc causing back pain or the nerve causing leg pain. Then when you stand, if you get pain standing, that's classic for spinal stenosis, because when you're sitting, your spine is flexed open because your hips are flexed. When you stand up, it closes down. So when you stand, the spinal canal, the bony anatomy closes down, which can pinch off the blood to the nerves. That's what stenosis is restriction in the canal. When you stand, it gets worse. So a lot of old people walk bent forward a little bit and just kind of hunch over as we walk and as we stand, because it opens up the spine and makes a little more room for the nerves, increases the blood flow to the nerves. So if you get pain from standing and you got to bend forward a little bit to relieve it, and if you walk, it feels a little bit better because you bend forward a little bit. But then after you walk for 5 or 10 minutes, it catches up to you. Then the pain comes back on. It can be spinal stenosis pain from the nerves being pinched. If it goes down into the legs, especially if it goes behind the calves, into below your knees, we pretty much know it's nerve pain. If it stays right in the back, it may be nerve pain, but it also may be arthritic pain that goes into the back. But that standing is the classic for spinal stenosis, nerve pain. Feels better if you lean forward. Feels better if you bend over a shopping cart. If you're bent over a shopping cart, you're walking hunched over, your spine is more open, people will last longer. Back to the back pain, mechanical arthritic back pain. That's the other source of pain, is just wear and tear. The disc and the facet joints, the wear and tear of life, well, that's mechanical arthritic pain. Now, when I say arthritic pain, some people think that I'm blowing off the pain, saying, oh, you got arthritis like everybody else, suck it up and live with it. That's not what I mean. Arthritis is like the devil. Arthritis is the slow death, the wear and tear and destruction of the joints and of the discs that is horrible. That's what causes all to have pain after the age of 28 or 40 or 50. It's probably just going to get worse as we get older, isn't it? So arthritis is wear and tear and degeneration of the discs and the joints. That causes mechanical arthritic back pain. How do we discern that? Typically, you wake up with it. You first wake up in the morning, you're stiff. Takes about a half hour to loosen up. You take a hot shower, it loosen up, starts to feel better. But then towards the end of the day, the more activity you've done, more lifting and using your back, the more it starts to hurt again. That's typical for mechanical arthritic degenerative back pain. So that's kind of how we work those out. Then the last one I'll mention is the extension. If you lean back and you get pain right in your back from leaning back, extending back, that's more likely to be a stress fracture if you're under the age of 30 or 25, and 15, 16-year-old is really the hottest time. Or if you kind of lean back and rotate and it hurts, it may be your facet joint. Because for every disc in the front, you've got these two joints in the back, and when you lean back and rotate, you may load that facet joint. So that's the other thing that we get from that. And then going back to this back pain versus leg pain, we really need to quantitate how much of each one. And we do it 100%, 50-50, 80-20, 90-10. What percent is the back pain? What percent is the leg pain? Because that helps tell me how much pain is mechanical arthritic back pain versus how much pain is nerve pain into the leg. And in general, the surgeries we do help best and most reliably with nerve pain into the leg. Back pain, they may or may not help. Sometimes they do, and it's worth doing. Nerve pain is where all the money is. That's where our best shot. You want to bet on spine surgery, you got leg pain, that's when spine surgery usually helps because we take the pressure off the nerve, whereas nothing else really does. And so we really need to quantitate back pain versus leg pain to know disc pain versus nerve pain, mechanical arthritic back pain versus nerve pain into the leg. And the other part I rely on from patients is to quantify this. And I know some people just hate putting numbers on their pain. Some people just refuse. But we need to know 1 out of 10, what number is your pain? If nothing else, insurance companies will not authorize tests and treatments and surgeries unless you say you have a pain of a 6 out of 10 or more. You say a 4 or 5 or you refuse to answer, you're not going to get treatment. So we got to quantitate this. But it also helps me to really understand how much is this impacting your life. 10 out of 10 is absolute agony, the worst, you can't even stand it. 5 out of 10 is solid. I mean, that's really bad. 5 out of 10 is 50% of your whole life. So we got to quantitate this. And part of that is, so I really know, is surgery indicated? And also, or have we responded to treatment? We try something, has your pain gotten better? Now, we really need to quantitate this. Despite how hard it may be, that's what we're dependent on as the doctor, because I can't measure pain. So I'm dependent on a quantification in order to make a risk assessment to know whether it's worth doing a surgery or even an epidural or anything else. And ultimately, the result of like our surgeries, pain typically averages a 7 or 8 out of 10 before the surgery, and it averages a 2 to 3 out of 10 after the surgery. So if you're at a 7 or 8, we may be able to help you. But if your pain's a 2 or 3 out of 10 before surgery, it's probably not worth having the surgery because that's the results of the surgery. So that quantification, 1 out of 10, helps us, helps insurance companies, helps research, and we really got to nail that down too. As much as I know it hates some people to put a number on it, but it really helps us be on the same page as to what's going on. So today we went over the history, the different things we look at, the back pain, the leg pain, the disc pain, the nerve pain, quantification, and that really helps guide us as to what's going on. So feel free to reach out. I'll put that link below for a video of everything we have with our app and our podcast. If you have any questions, put them in the comments, and I hope that's been helpful. Hope you guys have a great weekend. Bye.